Hi guys, welcome back to my channel, Honestly Invisibly Sick. It feels like it has been a minute since I've done a video, and it has, with everything that's been going on. Life has got turned upside down for a lot of people, and we're homeschooling our kids now, and just the imminent, I don't know, people being scared that they're gonna get it. If you guys watched my last video that I did, sit down video, I kind of explained I'm not really worried about getting it because I know if I get it, God's got it. And that's all I want to say about it. I am taking precautions that CDC recommends and a little extra precautions, and I am staying at home. But I just wanted to kind of give a life update as well as an eye update. And before I get started with that, I just want to let you guys know, in case you're new to my channel, I have lupus, rheumatoid arthritis, fibromyalgia, psoriasis, chronic dry eye. I have, my doctor believes I have Sjogren's syndrome. He kind of tests me every 3 months, waiting on the antibodies to show up because he knows that I have it, but he just wants to have that concrete evidence of the antibody, I guess, coming back positive. I don't know. I also have glaucoma. I'm in the beginning stages of that, and it is closed angle or narrow angle glaucoma. And I also have corneal edema, which we believe is Fuchs dystrophy. And I'll get into more of what that is later, because I kind of did a corneal edema video a little while ago when I first got diagnosed, but I didn't really ask any questions, so I didn't go in a lot of detail with the doctor. And I kind of wish I would have waited, because the next time that I went back, he really went into detail with me about it. So I'll kind of get into a little bit of that today. But as far as a life update, probably like everybody else, just sitting, chilling out. I go to the grocery store once a week. I try to. I don't go to like the regular grocery stores that people go to. I'm going to like the mom and pop shops where there's not hardly anybody in there. If we need anything from the store, for like Walmart or anything, I'm not the one that goes. My husband goes, and he's really careful about washing his hands and not touching a lot of stuff and things like that. I have went out, like I said, I do go to the store. I have to go to the grocery store. I can't not go to it, because I don't know how you guys' grocery stores are, but our grocery stores have shut down at night. So when my husband gets off, by the time he gets off, there's like a short window to where he would be able to go to the store. So he just doesn't want to do it. But I've got enough stuff now. I think I won't have to go to the grocery store for a couple of weeks now, except for like your necessities like bread and milk and toilet paper, should you be able to find it. So that's pretty much that. I'm going to be dealing with the challenge of homeschooling. She starts officially next week. She was on spring break this week, so they didn't do it, but the week before I was kind of homeschooling her on my own, like figuring out where she had left off at. I'm sorry, my eye keeps straining, and I forgot to include that I have duct plugs in my eyes, and it causes my eyes to constantly drain, but this is a better alternative than them being as dry as they were before. Not that they're not dry now, they just stay that way. But anyway, I know you're not supposed to touch your face. The CDC recommends not to touch your face. You guys don't touch your face. Don't do what I do. I take way too many eye drops, and my eyes constantly drip tears, so there's no way for me not to touch my face. So you guys do what the CDC recommends. I can't. There's no way for me not to touch my face. I take way too many eye drops, so I'm just being as careful as I can with it. And I think that's it. I do want to say, I had to go to the doctor. I'll just get into the eye doctor aspect of it, or the eye update of it, and we'll go from there. I'm not a medical professional. I am just a person who deals with it, and I'm trying to give you my angle of what it's like for me to go through it, and also some of the things that my doctor says to me. So just wanted to get that little disclaimer out of the way. So I went, I think it was 2 months ago, because I went now 2 more times since he diagnosed me. I was diagnosed with the corneal edema 2 months ago, and um, sorry, I don't mean to keep saying and and I'm trying to stay focused. I have fibromyalgia, so that and lupus makes it really hard to stay focused. But anyway, he diagnosed me with corneal edema, and I want to kind of go over some of my symptoms. I really do think, in hindsight, of really getting to dive into it um, a little bit deeper than what I had before I put the video out and getting to talk to him. I do think that I've had this for a very long time, at least 3 to 4 years, if not longer. I probably had it whenever I had to stop working in 2016 due to the exasperation of my lupus and not knowing what I had, and just couldn't get a handle. My doctor could not get a handle on it, and I just kept having a whole bunch of eye problems and stuff. I just had to step down from working. So that's probably what was, excuse me, causing a lot of the vision loss that I was having, that my eye doctor couldn't figure out at the time what was causing it. I had went all the way down to the university, or to a major university here in the state of Florida, and they couldn't figure out what was going on with my eyes either, other than they knew it was autoimmune related, even though I hadn't been diagnosed with an autoimmune disease. But I don't want to go back all into that. I just want to get to the present where I'm at. So he diagnosed me with the edema. Like I said, I didn't ask any questions. I was just like, okay, this is what it is. I'm just gonna go home and I'll research it, and just, I didn't want to know anymore. I had been in that, hadn't been that long ago since I had been diagnosed with the narrow angle glaucoma. So I was just like, it seemed every time I was going to the doctor, it was something bad, or eye doctor, it was something bad, something bad, something bad. So I was just like, I'm not even gonna worry about it. So when I went back for my follow-up appointment after he diagnosed me with the corneal edema, I was having some issues. Whenever he diagnosed me with the corneal edema, he put me on Mural 128, and that's kind of like an eye ointment in a tube. It's the second eye ointment that I take in a day. But I was taking that just one time before I went to bed. It's like thick and goopy. It's like putting milk in your eye, even thicker than milk. But so I was taking that, and I was having a lot of trouble with light. If I went to go outside, my eyes were just shutting. I was having to get somebody to help me to the car. I mean, I used sunglasses, but my sunglasses just were not doing enough, and I was having a horrible time seeing at night. Even in the house, it was bad with the lights. Any lights that are on, or any lights that are around me, it's like they have a firework around them, and the firework is kind of coming at me, like it's exploding, and it came at me. That's what it looks like. I know that sounds crazy. That's a weird way to describe it, but that's what it looks like around every single light. Before I got diagnosed, I was having halos appear around the lights, like a rainbow halo, and it was just like really cloudy in the mornings. When I would wake up, it would take forever sometimes for the cloudiness to clear out of my eyes. So that's what was going on before he diagnosed me, and why he made that diagnosis. And of course, he checked the thickness of my corneas. Normally your cornea thickness is like, I don't remember whether it's milliliters or I don't remember how he said it. He told me, but I don't remember if it's milliliters, milligrams. I don't remember how he checks the thickness, but I know that it was, the normal was like 600, and mine was 1300. Over 1300 in both eyes was the thickness of my corneas, so it was not good. And anyway, I went back because I was having, like I said, a lot of problems with the lights. I was pretty much at night, it's like basically blind. I've had night blindness for a while now, so where I don't drive at night. I haven't drove at night other than like a quick trip to the store right down the road, which I don't normally do. Like, that has to be a serious situation for me to do that. I think it's been for like 2 or 3 years now. So I don't normally drive at night, but the night blindness was so much worse. Even to ride in the car at night was just horrible. So he upped my Mural 128. He said you need to take it in the morning and then at night. And also in that appointment, he went ahead and broke down what he thought that I had and what was going to happen with having the corneal edema. And he told me that eventually I'm going to have my corneas, I'll have to have corneal transplants done in both eyes. And this is something that is not artificial. Like, this has to come from a donor, so it's kind of weirding me out a little bit. But that will have to happen eventually, but he's trying to hold off so I don't have to do it right away, which I don't want to do it right away. I'm not in a hurry to have to do that. So I went back a week after this past appointment, and because it was just getting bad. Like, he told me this was going to progress very slowly, and I'm telling you, like, right after he diagnosed me, it started getting bad. It started getting really bad, really, really bad. And I was like, I thought this was supposed to progress slowly. And I even called him on the phone and I said, you know, I told him what I was going through and described my symptoms. He's like, I really just think this is the progression of the disease. So I went back and I saw him the following Monday, and he put me on allergy drops because he said that he thought that was affecting it as well. So he had written me a prescription for, I don't even know the name of the prescription because I was like, I'm not getting it. It was $200, and I said, I'm not going to do it. I already take expensive eye drops, and I'm not going to take another expensive eye drop. So he wound up calling me in Pataday, and that's an over-the-counter eye drop, but I had to get a prescription for it because they just released it like 2 weeks ago, and I guess they didn't distribute it as much as what they should have because they didn't think that people were going to want it. So I had to get the prescription of it, which is the same thing you get over the counter, but it just costs a little bit more, which is what it is. I'd rather do that than pay $200 for a prescription. But I wanted to mention that after I saw the doctor that following Monday, which we got in an accident. My mom took me, her and my stepdad, and we got in an accident on the way back. It wasn't a bad one, everybody was fine, but what should have been, well, already was probably a 4.5-hour trip turned into way longer than that. But anyway, I'm not complaining. We all made it through. My mom's got her car fixed and everything. All of it's already worked itself out, and she's doing okay. She did get a little bit hurt. I think I pinched a nerve in her back, but it's not so bad where she has to have surgery or anything. She's just doing physical therapy. And I think that brings me to right up until now. As I said, he thinks it's Fuchs dystrophy, and that is hereditary. My grandmother could not see very well, and I've never found out what she had. She's been gone for a long time, so we never really found out exactly what she had. And my eye doctor is thinking that this is probably it, why she couldn't see so clearly and why she went blind. But I don't know. She also had cataracts and stuff like that, and she had just some other stuff. I'm not sure if that is what happened, but it's hereditary and it had to come from somewhere. So without getting her medical records, which we can't, that was just his best educated guess, is that that's what she had. So where I am now, as I can see a lot clearer. It took a few days, like I think it was like 3 days after seeing him, my eyesight started to get better without even taking the allergy drops. It took forever to get the allergy drops, but I just started them this week, and this was like 3 weeks ago because I just went and saw him this past Monday, which was the best eye appointment I have ever had with him, because I normally it's a struggle to see what's on the board, or you know how they have you look at the eye chart. It's always a struggle to see that, and it takes forever. But this time I was able to just like boom, 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 all the letters and numbers, and I was just so excited. And I could tell that he was really happy for me as well, because it had been a long time. Like, I have been going to this doctor for 3 years, and I have had 3 years of a struggle. And bless his heart, he has tried so hard to help me. Before him, I don't know if you guys remember me telling you, if you watched my eye video, the first one that I did, I was going to get sent to another major university, and my eye doctor just happens to tell me you need to try him and see if, or the an eye doctor that I was seeing at the time was like, you need to try him if this doesn't work, or you need to try him, but at the same time go to the university, which I never went to the university, because when I came and saw him, he seemed like he had a handle on it and was giving me some treatments that were actually working. And I don't blame me. I'm not mad at him for not catching that, because I guess if you don't know to look for it, you don't typically look for it, because the symptoms are so like spot on for that condition. And I just thought probably the same as he did whenever I was having a lot of the not being able to open my eyes and stuff in the light, or a lot of sensitivity to light. We were just thinking it was because I have a lot of scarring on my corneas, which can cause that, and I've had a lot of iritis, which has done damage. Every time that I have had a chronic condition or chronic case of the iritis where it takes forever for it to go away, well, that does a little bit of damage to my eyes, and we were just thinking that that's what was causing it, and not that I had Fuchs dystrophy or corneal edema. He hasn't 100% said that it's Fuchs dystrophy, but that's the way that he's leaning, so that's why I go ahead and say that that's what it is. And that is not caused from an autoimmune disease. That is just something that happens to be inherited. And I don't want this video to drag on. I feel like it is dragging on, but it's a lot to cover. I'll probably do another video on Fuchs dystrophy, and I want to do one on Sjogren's syndrome, because like I said, that's what he really believes that I have, and there's a lot to cover there as well. And I think that's it. Just thank you guys for watching this video, and I just pray that you stay safe, and that you guys just be cautious, and that's it. Thank you so much. Have a blessed day. Bye.